So Daria, maybe we can now
Maybe we can go ahead. Thank you, Ella. Well, good afternoon, our dear panelists, dear AmCham members, everybody who's attending this roundtable. Welcome to the AmCham Healthcare Roundtable meeting. This time it's devoted to the topic of e-health and innovation, from words to action. That's how we named it. My name is Daria Sivavol, and I'm the CEO of AmCham Estonia. We are proud to have 5 active committees at the Chamber, and one of the biggest committees that we have is the Healthcare Committee, consisting of over 30 member companies representing various sides of healthcare. We've got pharma companies, medical device companies, healthcare services, e-health, IT, academia. So today we're honored to have 3 speakers from the public sector and 5 speakers from the business side representing our committee. And I know that we're on a very tight timeline, so I will not be taking too much of your time with this introduction. And I would like to go ahead and introduce our committee chairwoman, Ella Tam, who is the partner at Cobalt Law Office. Ella will introduce all the roundtable speakers, and she will also explain how she will run the discussion today. So I wish everyone a very fruitful discussion, and we welcome all those attending to actively participate in the Q&A section as well and discussion later. Ella, over to you.
Okay. Thank you. Welcome and good day to everybody. The purpose of this roundtable webinar is to discuss the status of e-health and innovation in Estonia. We are really happy to note that the direction to move towards outcome-based and patient-centric health system have been well acknowledged by the Minister of Social Affairs as well as Health Insurance Fund. The HIC is working on real-life developments. We are keen to hear what are the recent developments that both the public and private sector organizations have been working on. What is the status of the infrastructure developments? What are the next steps and how to accelerate innovation uptake? The private sector is keen to be a part of the developments. These are challenging times. Safety and health of people are most important, but challenges also pose opportunities. Could it be that COVID-19 could act as an accelerator for some processes? If so, this would be an interesting topic to tackle as well. We will now have 10-minute presentations by first the chairman of the Board of Health Insurance Fund, Rain Laane, then head of Smart Development Department of the Ministry of Social Affairs, Kristiina Hunt, then Director of Health and Welfare Information Systems, Katrin Reinhold. And followed by that, we will have a panel discussion with our public sector speakers as well as committee members in the panel to discuss and ask questions. And we will have Kalle Uibo in the panel. He's the value-based healthcare partner at AmCham. Then Edgar Slavsvirs, who is Baltic Health Policy and Market Access Manager at Medtronic. And then Martti Rillo, Head of eHealth Business Unit at Nordal. And I am the moderator. We have also members registered for the event and listening throughout the discussions. Our agenda will be such that the public sector speakers will speak until around 12:40. After that, there is the time for discussion. I will give all the panelists an opportunity to be heard. Other participants can pose their questions through a Q&A button. You will see it in the bottom of your screen. But now we are ready for our first speaker. I will now ask the other panelists to switch off their video, turn it on later when I ask it again. But we are ready to welcome Rain Laane, Chairman of the Health Insurance Fund. Please, Rain, the mic is yours.
Thank you, hello, dear AmCham. It's my honor and pleasure to be with you. And as you remember, we had a pretty close relationship, like 12 years in my previous career. But today's topic, innovation in the healthcare. That's my topic, and I do not show any slides. I just touch briefly some topics which we are dealing every day. A few things which we have done already, and I will reveal a little bit our plans for the next coming years as well. What we are dreaming and what we are planning to do. So I'm super happy that between the Corona crisis, we finished together with our dear partners the decision support system for the GPs, general practitioners, or the family doctors. And it was amazing journey. It's 1.5 years journey together, and now since I guess 1st of June, there is in their desktop, for GP's desktop, there is the special information about the patient and recommendations. What is the best treatment for that particular person? And also the system is ready when the data from the based on our genes and gene technology is coming, then even better decisions will be made. That's point number one. Second one is what we did and what is invisible for the patients and lots of people is the way better system for our hospitals and health service providers, because we have agreements with hundreds of them, and there is money flowing in and out, and the new system shows exactly where they are fulfilling the agreement. And we have waited this system already some years, and finally it's up and running. Third one, the pilot which we are ongoing, is the patient journey. When we talk about neurology and when you have stroke, then what happens? And the main idea is that the biggest challenge in the healthcare for the patient is that when you are in the active hospital, your situation is stabilized, and then after whatever 7-8 days you will be kindly shown that please take the next step, but nobody is showing what the next step is, the after treatment, the physiotherapist, etc. And our aim is to make that journey for patients way more smoother. And how we can do it, we can motivate the partners to work way more and better together, adding some additional money, because that's the pretty clear motivation. Beside that, we all want to help lots of people. And we have promised to the society that every year we want to do at least minimum 2 machine learning solutions. And one is related with the better control, how we are using the money which is meant for the healthcare. And our servers and machines are already pretty clever. I can give one example. It happens, and it happens still, that in the system we are getting some double invoices. We might say that this is a human error or human mistake. Some people might say that maybe this is a little bit more, but right now we have thought to our machines that we are getting annually about 10 million invoices, which is related with the health services. And our machines can go through all these 10 million invoices and find out with the probability between 95 till 98% if there are some wrong invoices, and then we can deal with the service providers. I believe that in the big system there are some human errors as well, and we can eliminate them easier. The other topic about machine learning is related with the chronic disease patients, and the machines are basically predicting, looking the data, looking the patient's data, that if they are not, for example, if they are not buying out the medicines which the doctors have prescribed them, we can see it. If they have not visited their GP, if there is not sufficient information, then the risk is definitely higher. plus some data-based measures, and we would like to predict if whatever stroke or any hypertonia is getting too bad. We want to help as early as possible. These are the things which were and is, and we have done it in the current year 2020. And I would like also give little glimpse ahead, the code names and projects which we are planning. And next year I would love to mention 6 or 8 of them. We all know that there is a lot of Google in the internet, and that you can Google what's wrong with you. We don't think that this is the best way to put self-diagnosis, but to provide this information, and people can do lots of things themselves. They can starting measuring blood pressure, which is relatively easy, ending up a little bit more complicated stuff, but developing these kind of self questioning systems to put the diagnosis in the little bit narrower corridor. That's one of the ideas. Second thing which we are putting effort is the patient journey when you are calling ambulance. And maybe you have heard that we have sort of e-ambulance solution 1.0. We want to upgrade it to the next levels, and that we can do only together with the full journey, starting with a moment when somebody calls 112 and ending up when the patient is stable, either in the hospital or the way back home. Another bigger project which we started this year is the new generation health information system. But I believe Katrin Reinhold from TEHIK will describe these plans a little bit more thorough, because this is, as many other projects, they are cooperation project between Ministry of Social Affairs, between TEHIK and many other participants in the health sector, also including the private sector. During COVID crisis, you know the sentence that we cannot waste the good crisis. So did we. And the services from the distant, they are right now live, that you can have a discussion with your doctor either old-fashioned way, using phone, but what we would like to do is they promote the video consultation part, and we can pay for these ones. There is the legislation change which happened, and next year we would like also to put more energy to the distant monitoring part, and that not only health, but or the heart monitoring, but some other monitoring ways as well, because the technology is developing, and why not to use all these kind of things which people are using every day, also connect with our health system. There is of course challenge that old school doctors, they would love to touch the patient. They are maybe not so comfortable using video conferences, but the feedback which we used Facebook, we got 80% positive answers that customers or patients, they liked it because they got what they need and their health went better. Also the queues are not so long anymore. Then 2 projects about the patient journey. We continue this stroke project, and also we want to start a project with the endoprothesis. So basically, if your knee or elbow or you have some challenges and you need the surgery, that how this queue goes, how to prioritize people in that queue, because right now we know that sometimes the queue is 3 years. and people are putting or doctors are putting people there because the queue is so long. If something goes worse, then at least you are in the queue. We want to change that logic, and definitely kick out the Excel table and use some better technological solution. We continue to put our effort controlling also how we are spending our overall health money, and make it way more automated. And also, as I described earlier, the machines will help us to find the right targets. So if we go and investigate something, then typically we know what we will find there. Earlier, we managed to do manually, our ladies did manually 20,000 checks. And these were kind of random checks. Yes, we found some things, but technology here will definitely help. And last project from machine learning side is also related with the chronic disease patients, together with the World Bank and together with our partners. And the aim is at least 100 health centers would participate on the chronic patients, way better monitoring, feedback, and these are the ways how we can help our dear people. So I hope I was brief enough. If you have any questions, then glad to answer when we have Q&A session. Thank you very, very much, and wish you a pleasant day.
Thank you very much, Rainer, for your thoughts. We are looking forward to the discussion with you as well. But now going forward, we would like to hear from Kristiina Hunt, who will be speaking on the topic of current priority developments for the Smart Development Department of the Ministry of Social Affairs. So, Kristiina Hunt, I understand you wish. I will also share the slides, and we are ready to go.
Okay, so yes, as Elo said, I'm Kristiina Hunt. The Smart Development Department of the Ministry of Social Affairs sounds a little bit funny maybe, but basically we deal with the digital projects. Then another team deals with the ministry's overall strategy, and another team is responsible for all the structural funds and EU and Norwegian grants planning. So this is all that we do. I'm going to share thoughts on two very concrete projects about how to bring the e-health closer to the patients. So not about our yearly plan, but more two very concrete projects. So first of all, these are what we call the key health solutions of Estonia. First of them, patient portal, is from 2008. And if you think about the systems that you're using in your everyday life, then how many of those are from 2008 and have been updated, but not that much since they were kind of born. So that's why, next slide, we are currently working on the updated patient portal project to answer the question of how to make it easier for the people or for the patients to keep track on their health and their illnesses. So we were mandated by the government to come up with basically like a proposal or a plan on what should be done to make it better. And throughout the 2020, there's been a design project together with the government's design team using the double diamond method to go through the process, to look into it, to analyze it. And we are about to present the results to our minister this month, in the middle of November. And actually today is the sort of the event that presents the findings also to the public. So there's a link later on, so you can join at 1:30 to see what's going on. Next slide shows you sort of the current My Health system in Estonia. It's way too complex from the structure. It has rather limited user experience. It speaks in the language of a doctor, not a patient or a person. And as of today, it doesn't anymore provide you with sort of the useful services that you would expect from the system to have. So in the next slide, these are sort of the three outcomes from the design process. The waiting line, the prototype of the patient portal, which should turn into a health portal, and sort of a nudging or a reminder system. So first of all, what people brought out in the interviews as problems with the communication regarding their health with the state is that it's kind of difficult to keep in touch or have a sort of a general overview about your state of health, about your health, about the sort of actions you should take. So the solutions that we're gonna hopefully see coming up in the next years is that we need to provide people with sort of a simple enough and understandable information regarding their state of health and their care or treatment plan. And they need to have an overview of what is going to happen, what are the goals, what are the sort of the prescriptions and the medicines that they're going to take in a more simple and easy to understand way. So the three solutions, the first about the waiting line is that we do have now the digital registration for the doctors, but it still means that if you need to book a time to see a doctor, you need to call or you need to refresh the page and look for the time. There is an idea developed by the design team that we should work on a more proactive way of approaching so that the system would actually start offering you times when they come up and asking you if these would be something that you would be happy with, be paid time by the government or an appointment that you can pay for yourself. So the second is this patient or health portal, a digital toolbox that would give you an overview, would help you to prepare for a doctor's appointment, would give you an overview of the examination outcomes, and also offer sort of the out of a visit communication platform with your doctor. Because not every time you don't need to go in, you can have other ways of communication. It would also give you a good health overview or a review and a treatment plan, and also more information than today about your prescriptions and medicines. And sort of the third thing is those reminders that today we still have no-shows or doctor's visits that could be avoided. So what could we do on that? And these would be the three next steps that we're then about to move forward with. In the next slide, there's a very tiny prototype overview. You're not supposed to see it because on the next slide, there's actually a video that you can watch later on that we're not gonna watch today because it's 5 minutes long and would take up half of my presentation time. But yeah, basically, since people today are keeping track on paper, are lacking those human languaged information or guidelines on what to do, this would be the one-stop shop and the toolbox of how to manage your health or your illness. So the next up, what we're going to do is actually focus on to analyze what are the services that should be in the patient portal, because our current estimate is that about 80% of the services that people are right now expecting or that should be provided in there don't actually exist today yet at all. So what are the services, what is the data that should move there, and what are the sort of legal limitations to actually make all this happen? So as I said, in the next slide for you to watch later, everyone who speaks Estonian, there's a video about what is the idea behind the patient portal. I think with another click, it will show the video, you can watch it later. And next up is an invitation today at 1:30, there's a Facebook Live from the Innoklubi, or the innovation program from the public sector, so 1:30 starts a bit about the patient portal, if you're interested. Unfortunately, it's in Estonian, but anyone interested can go and see it. The other project that I think would interest you is our consent management service project that is also ongoing. In the next slide, which is to answer the question of who and how can access health data and develop services using our health data. So the next slide is something that both me and my colleagues have always been using in our international presentations, saying how in Estonia, we own our patients own their data. We as patients own our data. We control it. We see who uses it. But this project would take us a step further and would actually give us a chance to say that, okay, you own your data, but you also have a right to take your data and forward it to a service provider who would maybe offer you services that the government, for whatever reason, doesn't provide you with. So in a machine readable format, we could use the health data, gather it in the state system, and use it in the third providers' applications or solutions, be it a mobile app or something else. Because this is the expectation that we actually see from the people right now. In the next slide, there's an overview of what is currently going on. There's an impact assessment that was procured by the Ministry of Social Affairs. Ernst & Young is our partner in doing it. It should be ready in January 2020. It is focusing on the example of two of our health databases. One is the Health Information System, and the other one is the Estonian Medical Prescription Center, or Retseptikeskus. And the aim of this is to assess from three perspectives how to use that information. From the perspective of a user, so what is the user expecting they can do with their own health data? Also from the information systems level, so if we're looking at the service, what is the business processes, the technologies, the regulations we should be looking at? What would be the roles or the risks or the costs? And also from the cross-sectoral level to map the impacts, the barriers, all that. And in parallel to that, there is actually another analysis going on that is done by Information System Authority in cooperation with Helmes. And they are developing sort of the central solution of the consent management service. So when we are looking at concrete systems, they are looking at how to, in a simplified way, say how to create sort of I don't know, a smart ID or a mobile ID, kind of a simple enough central solution so that people can give their consent, they can also take it back, and how that should be managed. And this is also a project that should be ready by the next summer, so the summer of 2021. Key issues, as shown in the next slide, are basically about like how much should we protect the person, so the data subject, how much should we decide for them what can they do and with whom they can share their data. So should the state decide and what should the state decide for the person? So should we look at the purpose of the service? Should it be the same as currently the health information aim or purpose is? Should it just be services supporting the protection of public health, or can it be wider? Can it be anything else? Should we look at how ethical the company is? Should we look at the technical or technological sustainability, or the principles of minimum data composition? So what are we giving out? How do we control it? And also how limited should the data sets that are given out, how limited should they be? And also we're very much interested in getting a cost analysis, because clearly state coming in and starting to work on that front would bring costs for example, to our IT agency, TEHIK. So when we're giving out data or filling data requests, how those costs are distributed between the partners. In the next slide, there's a very, very basic, very short overview. If you do another click, then we see in green how the consent would flow. So from the central consent management service that would be provided in the future by the Information Systems Authority. The databases would be the health, in this example, the health databases or the health information system, for example. And the client part would be sort of the third-party apps where the consent would be sent. And with the next click, we see then how the data in the black would then travel between those databases and the third-party apps. So a very, very basic idea of how it should be. And in the last slide, very quickly, is the outcome we're kind of going for, which is if we have a service provider with the service idea, if we can approve somehow the service, we can develop the interfaces between the service, the necessary data, and the consent management system. We can then release the consent, the data that has been requested. We can monitor the use of the data and then also review the process of the service updates. So if the service is updated, should you ask for permission again, or is it still all good? So this is the process that should be a lot clearer by the end of the year. And hopefully we should already see the first services being developed by summer 2021. There should be a pilot project. And as I understand, there's currently negotiations going on with a company who should do the first pilot. So they're in the process right now. This is, I hope I wasn't too quick, all from my side. Thank you. And I'm very happy to answer the questions later.
Thank you very much, Christina, for your insight, information into your department activities. Now, let's also hear from Katrin next, and then we will have a discussion going forward. So Katrin Reinhold from TEHIK, if you can go next, and I hear that you haven't also faced the crisis. So what is it that you have been dealing with? And if you can turn on your video as well, that would be really great.
Yeah, thank you, Elo, but somehow I don't manage to turn my video on. Can you allow me, most probably?
Yeah, I have put it separately. Yes.
Yeah, very good. Yeah, thank you very much. And hello, everyone. Yeah, as said, I'm Katrin Reinhold, and I'm the head of the Health and Welfare Information System Center, TEHIK in Estonia. And what my organization is taking care of is the ICT Competence Center in the field of the health, social security, and the labor field, and under the administrative area of the Ministry of the Social Affairs. And I will give you a quick overview today about two topics, basically. As the first thing, I would like to focus to the data and opportunities that we haven't used them so far, or where the TEHIK will focus in the nearest future. And secondly, I will share the solution from the pandemic period. That was a bit a learning curve for us, but it was also related with the open data topic and its opportunities, basically. And as the background, I would like to share that over the years, it has been clarified that it is necessary to use a solution that is designed to be more flexible and changeable in the health information system, where the data is available at the moment where the decision making should be done, not like the archive system as we have the existing one today. And where the TEHIK will focus, of course, the platform of the health information system that has been a bit like outdated from the architecture point of view. And as well, we have slowed down the developments. And what we like to have, of course, increase the developments power and slow down of the prices and the cost-wise. And in the nearest future, the biggest challenge for the DEHIC is to develop the next generation health information system. And what we aim to allow to develop more efficient solution while giving the flexible in the exchanging of the health data between the ecosystem and between the healthcare providers as well. Today's health information system provides detailed exchange services largely based on the transmission of the clinical records at the end of the clinical session only. And in the future, the data exchange system will replace the current system, more flexible data exchange. So we are starting to use the HL7 FIR fast healthcare interoperability resource standard. And it will allow us more robust data exchange capabilities as well, the simplified developments and extensions there. What we try to do, we are planning to replace the data exchange by the new system, and the current data will be migrated from the old system to the new one most probably. And the new platform can also continue to offer the existing solutions as well. Our task, of course, is to turn this data into the information that can be used to make informed decisions and to consolidate and link information into models so that more meaningful decisions can be made while having a bigger impact to the future and the predictive modeling as well. The whole development must be supported by an operating model as well. And what we have that the current operating model doesn't control where the data ends up, but the future platform and operating model, we're planning so that it will be smart enough to know where the data ends or doesn't end up. In addition, the meaning of the data as the metadata is known. So what we have reached so-called second level data post-processing. This means that we have moved beyond the reports, but we are carrying out the analysis scope as well for the specific goals or indicators and compiling this data into a complete life cycle and creating the whole picture, so-called like model-based forecasting, using those forecasting management decisions and also the conscious management. Like that's the task that is still ahead, but we have started to progressing in this field as well. And the most important thing is to focus on effective data use. Above everything else, the system setup could be proactive, which means that the data collected could be used to prevent diseases as well. Not simply like collecting the data, what is more expensive than to cure. That will be, of course, the focus. And the added value of the data can be seen throughout the person's life cycle as the pathway. And it is very important to assess the possibilities for integrating several areas immediately, like this labor, health, social security, education, etc. And what I would like to share as the second topic for you, it's related with the pandemic period solutions. As you know, that the existing infrastructure and the biggest advantage for Estonia have been that the health sector and all the health data is collected centrally. And what we missed in the beginning of this pandemic period was the human care pathway as a whole system. And pandemic period enforced us to link those different services together as a whole patient care pathway, not as the separate medical documents like test results, ambulatory case summaries, hospitalization, stationary case summaries, healing, or even the death documentation. But the whole pathway from the patient pathway perspective was needed to make actually the better decisions or to use the predictive modeling to manage the crisis. And what we did actually, we did that the data about the test results and hospitalization resource data, it was all loaded to the warehouse. And we used this data basically for the crisis management dashboard, for decision makers, to the health board, Ministry of Social Affairs, and even the government basically. And last but not the least, the open data topic as well. Besides the crisis management, overall the community desired the data about COVID-19 test results during the pandemic period, and all the hospitalization and overall the situation of the pandemic period. And what we did, we basically published the open data in the open data portal once per day. And the dashboard in the health board webpage is published once per day. And as the summary, I would like to say that it was the first time in the field of the health that the open data sets are now published in Estonia. It enabled access actually to the data, and it gave a lot of the opportunities, in my mind, as to the public sector, to the research institutions, to make necessary forecasts, to make necessary calculations, to make a bit like predictive modeling, and also create new solutions on top of this data. So, and that's shortly from my side. And as Christina and Rand also mentioned, that many of the projects we are doing in cooperation with the ministry and the Health Insurance Fund. So thank you from my side.
Thank you very much, Katrin. This is very interesting. Now I would like to ask all the panelists to turn on their videos, and we can have a discussion. I can also see that there are questions coming in, so please also use the Q&A button for those who are participants. But in order to perhaps lead in the discussion and the topics, it would be good to hear from the committee members what are their views and what are the thoughts on the presentations as well as developments which are necessary. So perhaps Kalle Uibo, if I can ask you to be the first one, what are your views on these discussions as a private sector stakeholder? And do you have any suggestions or questions based on those presentations that we have had and possibly beyond? So Kalle, please go ahead.
Thank you, Elo. Yes, as a representative of the pharmaceutical company AmCham, and as a person who is involved in the deployment of innovation and also market access related questions, these presentations are reflected really well back to me, because from the pharmaceutical company perspective, we are all understanding that from like a larger scope of view, that as the health technology in general, in terms of the solutions is developing, it is getting more precise in the solutions provided, but at the same time the solutions are also perhaps costing more, and therefore this and we need to therefore know how well are they working, and then therefore hence the need for this outcome based developments, and also a need to put in for the patients to put in data so that we know how these treatments are working, for example in my case the pharmaceuticals. And then therefore we are also looking very and have looked very intensively how we could develop different kinds of pilots and deploy them also in Estonia in terms of measuring outcomes and also getting this dialogue. So and I have a feeling that now we are presently in this kind of state of between two let's say stages, the old and the new, and therefore we probably need to also start different kinds of pilots to see what works, which doesn't work, because Estonia is really the leader in these fields, and we cannot really look to the other countries, what are their solutions. So that's like my first thoughts. It's very inspiring, and at the same time there is also from our part to contribute into this kind of journey. Yes, thank you. Yeah.
I saw Christina Hunt nodding in the meantime. Maybe this is something that you want to kind of reflect on.
No, I mean, very much. I mean, doing pilots in Estonia and providing data for those pilots is definitely something that is very important to us. So I can only agree with that. So making that possible is something that is definitely a common aim.
Yes, and also maybe to have discussions how private sector could also contribute into this, because sometimes with innovation half of it goes into bad way. We just don't know which part is the sort of a good and bad. So
True. Okay.
Ryan, is there anything that you want to comment or suggest? I mean, from the financing part as well, with those pilots, how would that work?
Yes, can you hear me first? Okay, regarding sharing the data, I love pilots, I love proof of concept, and in especially healthcare, we can start good projects with the pilots and then finish them as the real project. But I want to raise one concern or one challenge which we still have. And that's the speed of exchanging the data. And we have spoken with the DPA, the Data Protectorate Agency, or whatever the name is. And there are still challenges. If we want to use and share data, I'm talking about how we can open some data for the private sector. There are lots of ethical questions, of course. The simple thing, the project called Volli, this is simply people are giving proxies, and can I give my proxy to my phone app in my phone that please take some my health data, and that we are pushing pretty hard. There are several institutions in the public sector who are dealing with that one, and the Health Insurance Fund wants to be a pilot there to open more data for the doing cooperation with apps, etc. But there is a long way to go. It's slower than we would wish it is, the process.
I think this is a good moment to give floor to Martti Riilo. Maybe you can also give us some views or thoughts on what is the private sector view of the health of the e-health system, and perhaps any questions or thoughts about it.
Yes, I first of all thank you, Kristiina, Rain, and Katrin. I think presentations were really inspiring, and you can see the whole ecosystem working from different sides. And as Rain mentioned, I also really love the proof of concepts, and I really enjoy that our state is actually moving more into the proof of concept area rather than just building a system and finding out that it doesn't work, and then we have wasted lots of money. But what Katrin mentioned, and maybe it's a question for Rain, you that Katrin mentioned that we have seen a progress of healthcare world along with the rest of that. We are moving away from sort of the document-related words and health record exchange into stepping into the FHIR and database world. But my question really is that how do you see the financing of health sector changing along the way, and how do you see any changes along the way in financing the healthcare sector if you are moving into the sort of the data exchange world and into the FHIR world pretty soon?
Rain, are you with us? Are you able to comment
yes,
on this?
Let me switch my video back. So good question, and we definitely need to change the mechanism how we finance the whole health sector, because already next year the deficit will be at least 160 million, and in the timeline it's only increasing. So next 4 years we have agreed by government how to do it, but we need to change the fundamental principles. There are some ideas offered, and like majority of them is trying to answer the questions where to get more money to the health sector. Because comparing to the European Union, other countries, the health sector in Estonia is getting only 6.7% from GDP, while in Germany, Netherlands, the percentage is 10+%. And that puts a huge challenge to us. This is a political question, and we need to help politicians to solve that one. And the data exchange helps a little bit, and also using technology helps a little bit. I personally think that the biggest help we can provide everyone, we can provide ourselves while we are living more healthy lives. We can live healthier a little bit longer than we do it today. The critical year for men is 52 when they turn to the average man in Estonia turns to the doctor by 52, 53. Ladies a little bit later, but this is how everyone can contribute, looking what we contribute, what we eat, what we drink, what are our healthy habits, how much we are moving. And I personally recommend take a dog or cat or someone who pushes you to walk every day minimum 5 kilometers. That helps. Look at me.
These are very good recommendations going forward. Edgar, maybe you can bring in some thoughts from our neighbors. You are the manager for a medical device company on a Baltic scale. So perhaps there are some discussions or thoughts that can benefit our Estonian discussion that you can point out.
Thank you. Well, first of all, I'd like to thank and for the presentations and reflect in a couple of sentences. It's really great to see the leadership of the health sector in Estonia are very clear of what they want and where they are headed, and it's clearly the value-based healthcare, and also more patient-centric care. And again, being very specific, patient-centric through patient empowerment, through giving data, the access and the management of the data into the hands of patients. And actually, this is what we are going to talk a lot about in Latvia during upcoming health data conference in the end of November by Ministry of Health and with the collaboration of AmCham. And my question regarding the innovation and the speed of uptake, new solutions. You mentioned, Ryan mentioned teleconsultations, and maybe there are more, maybe there are some digital therapies, also telemonitoring. So what steps are taken to speed up this process? Because we know that it's taking time for the healthcare provider or the society of physicians to apply for the reimbursement of new service and to design a new service. So is there any new process? Again, from experience of Latvia and Recovery and Resilience Fund, in context of it, we are talking about innovation fund for the services which are not yet golden standard somewhere across the Europe, yes, but also same digital therapies which are being developed domestically, and so to help them to be piloted, to be checked the feasibility of such services. They cannot be reimbursed through traditional channel, and maybe there are some steps, practical steps which are done in Estonia in that context.
I can give a very short and quick answer. Yes, we do have innovation fund among Estonian Health Insurance Fund total budget. And how to use that fund, there are 2 board members from our side and 2 deputy general secretaries from the Ministry of Social Affairs who decide where to use it. We didn't know that COVID is coming, but we started preparation of the long-distance treatments already a year ago. And we got some political resistance, is maybe too strong word, but political challenges, especially, when the old school doctors are saying, no, it's not a good idea at all. Younger doctors are saying the whole world is doing it. And we were just lucky when COVID came, 2 days from the special situation in Estonia, we had the electronic conference, what to do with the long distance treatments. We got acceptance finance that one, and then we quickly changed the legislative part that we can finance them. And right now we basically did the compromise that, okay, not the first visit, but the second visit can be done via telemedicine. And that is the recommendation. Just use the window of opportunity and act quickly.
But do you think it will stay for some longer time, or is it just
yes.
For the people?
The long distance treatment have come here to stay definitely, and you need to be wise. You need to do the feedback sessions. You need to explain. You need to use social media. You need to educate politicians. If you want to achieve, then you need to be active everywhere. You need to gain allies who will support this idea, because there are tons of challenges and the educational part for the doctors, how to handle the technology, that's enormous. But it's a good examples, just do it. And right now we are doing the conference electronically. This has become like a new norm of the life, and the homework has become the new form of life. And when you take the psychiatrist, for example, people are saying it's way better to talk with the shrink over the video than to travel and wait in the lobby room and everybody are looking, especially when your face is known everyone else. So people like it.
Yeah, thank you very much for this talk. We have also one question from the participants, and I would address it to TEHIK, Katrin Reinhold, perhaps. There is the question that for outcome-based solutions, a combination of clinical, physical, and service provision data is needed. And the question is whether Health Insurance Fund and TEHIK have any plans to join or to take into shared use their databases in the future. So perhaps, Katrin, can you comment on this? Katrin, okay. There seems to be a technical question. Can you hear us, Katrin? Ryan, maybe you can. The other part was the health insurance part. Are you going to join the database?
Yes. One topic which I didn't tell much was the value-based healthcare part and how we support that one. One good example is the digital solution which we launched this autumn for the pharma companies when we want to share the burden, and we definitely have plans to continue that one, because that gives also our people better options to get healed. And we are planning in March 4th in Tallinn, there will be an international conference, most probably the hybrid one, because we don't know whether people can fly in. At least speakers could fly in, and we hope that even the commissioner Kyriakidis, she will participate. So that's definitely a topic. We will put effort, we will put resources, especially I think the human capital for that one. So value-based healthcare is definitely the direction which we support with all our hands and legs.
Well, this is a great sentence to end on. So we are also out of our time. Thank you very much, all the panelists and speakers, all the attendees for active participation, for the question. It was very short, but hopefully you got some thoughts out of it, and let's keep the discussions going on, no matter the format or the platform that we are using. So thank you all and have a very good day.
Thank you so much from my side as well. Thank you.
Thank you. Bye-bye.
Bye.